Hello, and welcome to today's Susan G. Komen's Facebook Live event, where we'll discuss the importance of the flu vaccine for cancer survivors and those living with cancer today, highlight the differences between the flu and COVID-19, and help dispel some myths and misinformation related to vaccinations. My name is Susan Brown, and I'll be moderating today's discussion. I've been with Komen for more than 20 years, and I have an oncology nursing background. Currently, I serve in the role of Senior Director of Health Information and Publications, where I work with a dedicated team to ensure the breast cancer information associated with the Komen name is safe, accurate, current, consistent, and based on scientific evidence. Joining me in today's discussion are Sydney Belilas and Natalie Kraus-Miller. Thank you both so much for joining us today. Sydney Belilas is an oncology specialty pharmacist and pharmacy manager for Walgreens. She has dedicated her 11-year career to the professional development of future specialty pharmacists and supporting those living with cancer. She's a member of the Healthcare Businesswomen's Association and Hematology Oncology Pharmacy Association. Natalie Kraus-Miller is the Senior Director of Clinical Operations at Adagio Health, where she oversees the staff and clinical operations of 8 Western Pennsylvania medical offices and 1 mobile unit. In 2020, she oversaw the greatly expedited rollout of telehealth services due to COVID-19. And in 2021, she played a key role in facilitating access to COVID-19 vaccines for residents of rural areas in Pennsylvania. Before we get started, if anyone in our audience has questions for me or our guests during today's discussion, please put those in the comment section. We have staff monitoring these submissions and will address a few audience questions at the end of today's event. We'll also put additional information and resources in the comment section throughout our discussion. If we can't get to your question during the live event, you may find answers to your questions in these resources. Now that the housekeeping is out of the way, let's get started with today's conversation. Natalie, I'd like to start with you. Can you tell us a little bit about flu season and what the data tell us about how many cases of the flu we expect this year?
Yeah, sure, absolutely. Thanks, Susan, and for the whole Komen crew for having me on board. This is one of my favorite topics to discuss, the importance of vaccines. So just like pretty much every aspect of our life has been affected by the pandemic, so has flu surveillance. The flu season generally runs October through March, but surprisingly, what many people don't know is that the flu exists and infects people year-round. It was really tricky for the planners at the CDC to project how many cases we were going to have this year, because of how unpredictable the last 2 years have been. For example, in 2019 and 2020, we saw 40 million confirmed cases of flu. And then a short 12 months later, when we were in the height of the pandemic, many people don't know, but we only had 2,124 confirmed cases last year. So in terms of what the experts are projecting, they're thinking that we could have around 3 million cases this year, but not 100% sure. What I've been keeping an eye on, and many other folks in the clinical operations in the science space, is the 2 projects that the CDC manages, which is Flu View. It's a week-by-week surveillance tracking project. And then the CDC also has flu forecasting, where they try to look ahead. Just to give you one more piece of data, Susan, the most recent week of Flu View, which was week 44, ending November 6th, they kind of report a week in arrears. We just saw 35,000 flu tests last week and 100 positivities. That's putting us at about a 0.3% positivity rate. So it'll be interesting next year to look back and see how many cases, we were at. They're thinking a little less than the projected 3 million, but not 100% sure.
Thank you for that, Natalie. Now that we have an idea of what the flu may be like this year, let's talk about some of the things we can do to help reduce our risk of contracting and spreading the flu. So, Natalie, what do you advise your patients to do to stay safe and healthy during flu season?
Yeah, sure. So Adagio Health, and of course, me personally, after 20 years in public health, we're pro vaccine organizationally and personally. I think it's really important for providers. What I have done with my patients is to establish a rapport and a vernacular that they can understand. When your patients understand the science of vaccines, it's a little easier to get buy-in. So I think it's super important to have some of that burden on the providers that they can explain the mechanism of action. And we don't really need to get too micro, but if you have a little bit of a higher level explanation, I explain to them, for example, that, while the COVID vaccine and the flu vaccine are a little different, they're designed to essentially poke the immune system to create proteins, which are the antibodies like the soldiers to fight the virus. We're in an era right now where there's a lot of information shared on the internet, right? People have a very difficult time qualifying that information, and there's a lot of misinformation out there. So it's important for us as providers, because studies have shown that our patients trust what we say, to be able to explain to them vaccines aren't 100% protective, but what they do is they reduce severity of illness, they reduce length of hospitalization stay, and they reduce morbidity and mortality. We know that. So this country has been celebrating a reprieve from vaccine preventable deaths since the 40s. We have nearly 80 years of vaccine preventable disease safety. And sometimes it's very difficult to get your patients to see absence of disease as a positive, right? It's a little easier to listen to kind of all the hype online. But what I encourage is the providers to speak at their level, be able to explain the mechanism of vaccine and understand their concerns, because there's a lot of misinformation flying around there. The final point that I would make, and I think it's really important for providers in Western medicine, is to be advocates of good health, clean eating, discontinued tobacco use, and being fit. Because if you help your patient stock the artillery, when they're ill, they have a way better chance of survival. But number one, get vaccinated.
That's great. Thank you, Natalie. A lot of what you described, as you mentioned, could be applied to preventing the spread of COVID-19, which leads me to my next question. So, what are the main differences between the flu and COVID-19, and how would someone know which one they have?
Yeah, really, that's a solid question. And I know a lot of medical offices are struggling with that right now. So COVID-19 and the flu are obviously, they're both viruses, and they're both respiratory illnesses, and they're both contagious. So those are the things that they have in common. They also both spread by droplet transmission. So viruses and bacteria can spread different ways. Those spread, according to the CDC, in about a 6-foot circumference. So if folks wondered where the guidelines came for social distancing, it's essentially the research that coughing, sneezing, talking propels those droplets in about a 6-foot circumference. So those are the things that they have in common. What are the differences? Research has shown that COVID spreads faster. We know that. We also know that COVID is contagious longer and has the propensity to have more serious consequences. Another thing that's really interesting to me, when you hear a lot of the falsehoods and rhetoric, going around, that the COVID is like the flu. It's actually very different. The flu is born about by the influenza virus, and COVID from SARS-CoV-2 virus. Also, if you compare and contrast their symptoms, what's very tricky about them is a lot of them are the same and overlapping, but COVID's got some very unusual characteristics. And another quite frightening thing about COVID is that the trajectory is unpredictable. Flu has been around for so long, and we've studied it for so many years, that it's somewhat predictable. We do know that we have deaths from flu, but the trajectory is predictable. COVID is unpredictable, and we need to have a healthy respect and fear of it, and absolute advocacy for vaccination. So I would tell you that the symptoms are much the same. You can jump on the CDC's website, from GI symptoms, sore throat, fatigue, malaise, headache, so on. I think there was one symptom that was different between COVID and flu, and that was new loss of sense or taste. But I would encourage the public to know that the only way to know is to get tested, and the only way to protect yourself is to get vaccinated. Symptoms alone are not diagnostic.
Thank you so much for that information, Natalie. Sydney, let's bring you into the conversation. As an oncology pharmacist, you have a lot of interaction with people with cancer who may have questions about getting the flu shot. Can you tell us a bit about the different ways the flu vaccine can be administered?
Yes, well, thank you so much for having me. It's an honor to be here to talk to you all today. So talking about the different kinds of flu vaccines. So first, there's several different flu vaccines. Make sure you ask your pharmacist or your healthcare provider to help you find the right vaccine for you. Regardless, the CDC recommends that everyone ages 6 months or older receives the flu vaccine each year. However, they don't recommend one flu vaccine over another. The most important thing is that you get vaccinated. All of the influenza vaccines this season are quadrivalent, which means that they have 4 different components in them to protect you from 4 different variations of the influenza virus. That includes 2 influenza A and 2 influenza B. There are many different influenza vaccine options with varying indications, such as egg-free and high dose adjuvant for older patients, and then there's even a nasal spray vaccine. So those who are 65 and older have additional options. I mentioned the high dose or adjuvanted flu vaccine as well. So these flu shots are specifically formulated for seniors, and in past studies have demonstrated better protection against the flu in those 65 and older. I mentioned the nasal spray as well. Get a lot of questions about that. So it is a live virus. It is weakened though, it's attenuated, meaning it's a weaker version. It cannot give you the flu. But therefore, because it's live, it's not recommended for people with weakened immune systems or those who are immunocompromised, or for the people that care for those who are severely immunocompromised. So what does that mean when we're immunocompromised? Why is it so important to stay up to date on your vaccines? When you're immunocompromised, it means that your immune system doesn't work quite as well as it should to fight off infections and diseases. So for example, those living with cancer, sometimes it's because the cancer itself weakens the immune system, and other times it's because the treatment, such as chemotherapy, radiation, even immunotherapy, those can weaken the immune system, and that leaves these patients vulnerable to even the most commonplace germs. So when you're at a greater risk of becoming ill from viruses and bacteria in your environment, it means that they're also at a greater risk for developing serious complications from those illnesses. So again, just really important to get that vaccine. Talking about this, we have some questions about barriers to getting the vaccine. So now we know we need to get the vaccine. Well, what happens if I can't get vaccinated? So some barriers that we've seen are lack of knowledge about the vaccine, hesitancy, and a lack of access. So to help address some of those barriers, Walgreens launched a number of educational initiatives, as well as created various partnerships to help meet the needs of each community. We've been hosting off-site vaccination clinics in underserved communities and partnering with organizations to increase the uptake of vaccines among underserved communities. We also started a vaccine access fund this year with Uber and PayPal, which the fund is granted and managed by Local Initiative Support Corporation, and they're a nonprofit that's helped to ensure transportation is never a barrier to getting a vaccine.
That's great. Thank you so much for this information. Let's talk just a little bit about getting the flu shot with a COVID vaccine or a booster. Is it recommended that people get both vaccines? And if so, can they be administered at the same time?
Yeah, this is such a great question. We get this all the time. So I already mentioned earlier that the CDC recommends an annual flu shot for everyone 6 months of age and older every single year. And kind of Natalie mentioned this earlier, but it's recommended to get it before the flu starts circulating in your community, and usually by the end of October to help reduce the spread of flu. However, even if you're not able to get vaccinated until November or later, vaccination is still recommended because the flu most commonly peaks in February, and significant activity can continue into May. And as she mentioned as well, it can take a little while before those antibodies build in your body. So it takes about 2 weeks for you to get full immunity from the flu after your vaccination. So you asked about getting the vaccines at the same time. So yes, the answer is that they can be given at the same time, and it's actually encouraged. So for an eligible patient, both influenza and COVID-19 vaccines can be administered at the same visit without regards to timing. If a patient is due for both vaccines, we do encourage our providers and our pharmacists at Walgreens to offer both vaccines at the same visit. And just a reminder, the moderately to severely immunocompromised person, so ages 12 and older for Pfizer or ages 18 and older for Moderna, they should receive an additional primary dose of the same COVID-19 vaccine administered for their primary series about 28 days or later after they complete their initial 2-dose series. So at any time during that, we can schedule and administer the flu shot at the same time.
That's perfect. That's great for patients. So we've talked a lot about the importance of getting the flu shot, and you mentioned some of the barriers that prevent people from getting the shot, but there may be some people who don't have access because of cost. So how much does the flu shot generally cost, and are there cost differences for the uninsured compared to those with insurance coverage?
Yeah, thank you. That's also a great question. So in general, the flu shot is covered by most insurance plans with a $0 copay. Although the provider networks may vary, so what that means is that your insurance may require to use one pharmacy over another, or to go to your physician's office to have the vaccine administered. In addition, those enrolled in Medicare Part B and many with Medicaid in certain states may also receive the flu shot at no cost. So some resources that we have at Walgreens, we distribute about 200,000 flu shot vouchers to various community and faith-based organizations nationwide. We use a lot of feedback from our field leadership to help determine and identify which organizations can best help to distribute those free flu vouchers. So we also have a prescription savings club with Walgreens, and if you're a member, you also receive 20% off of the cash retail price. So I mentioned earlier in our discussion too, the community and faith-based organizations and doing those off-site vaccine clinics. So we also offer and partner with those communities as well to be able to break down access barriers.
That's great. Thank you, Sydney and Natalie, so much for sharing this information with our audience. We are going to start the Q&A portion of the event in just a moment, but if anyone has questions for me or for our guest, please drop those in the comment section. But before we get to Q&A, Sydney and Natalie, is there anything else you didn't get to mention, something I didn't ask you, but something you'd like to share with our audience? Maybe we'll go to Sydney first.
Yeah, absolutely. I just wanted to make sure to encourage everyone out there. Your Walgreens pharmacists are trusted health resources. We are embedded in all of your communities. We're available to talk anytime. We can discuss a lot more about what we talked about today. There's several ways you can get in touch with us. Of course, I mentioned our local stores, and then you can also use our phone number, 1-800-WALGREENS, to call and speak to a pharmacist. Or you can actually use our pharmacy chat, which is at walgreens.com or via our app. And then if you need any help scheduling these vaccines, you can go online to walgreens.com/schedule-vaccine.
That's great. Natalie?
Yeah, thank you, Susan. I think it's important for the community to realize that there are nationwide shortages, staffing across the board. I saw a news program this morning that was talking about the shortage even in frontline healthcare workers. And just to relate that concept back to vaccination, you don't want to gamble with your health. And I think that, when folks consider the benefit of vaccination for flu and for COVID, and what the consequence may be, which would be being in an, understaffed emergency room, maybe in a waiting bay for 4 to 6 hours, maybe a hospital organization where they don't have any patient rooms to transfer you to. There are a lot of complicated interplay, reverberating effects from the pandemic. And, if vaccination alone from the diseases isn't a benefit, to think about these other potential hazards to your health. So I just want to encourage people, to think about that and to definitely get vaccinated.
Great, thank you so much. So we'll take a few questions now from our audience. So you can drop those in the comment section now. I will start this off by asking about how important it is for caregivers, for those that are in treatment for cancer, to also receive a flu shot. I'm guessing it's important too. Sydney.
Yeah, I can speak to that. So, just as a reminder, the CDC is urging everyone eligible to get both flu and COVID-19 vaccines to help reduce the community spread of these vaccine preventable illnesses. And also another quick reminder, just about the nasal spray. So again, that's a live attenuated virus, meaning it's weaker, but it's not recommended for people with weakened immune systems from any cause, or for people who care for severely immunocompromised patients. So they often require a protected environment. So if you do choose to get the nasal vaccine, you do need to avoid contact with the immunocompromised for 7 days after receiving the nasal vaccine.
Great, thank you. So another question is, can you get the flu virus and the COVID-19 virus at the same time? I don't know, Natalie, should this go to you?
Sadly, yes. And just as a nod back to another vaccine, a complication of the flu could be pneumococcal pneumonia. I'm sure Sydney agrees. Many of those folks could also talk to their healthcare provider about the pneumococcal vaccine, but you can be co-infected. We're seeing a lot of inpatient stays where younger people are co-infected with RSV and COVID. So you certainly can have multiple co-infections of viruses. Back to Sydney's point, even a better reason to get your vaccines knocked out at the same time.
Thank you. So will wearing a mask prevent someone getting the flu? Natalie, is it, or Sydney? I don't know, whoever.
Yeah, I can tackle that one first, okay. And Natalie, I'm sure we'll have more to add, but so while wearing a mask can help lessen the chance of getting the flu, we know that as well for COVID-19. We know that the flu shot remains the best protection against influenza. So get vaccinated.
And then I once heard that due to the limited number of flu shots available, people who are at low risk of serious disease should abstain or hold off from getting vaccinated, so those at higher risk can have access to the vaccine. Would you say this is true today? Sydney?
So I can tell you from a Walgreens perspective that we have worked very hard with the manufacturers and distributors. So we are able to accommodate anyone that needs a vaccine at this time. So all people should come get vaccinated, absolutely.
Okay, and I see one last question. Could I take antibiotics if I have the flu?
That one will definitely be for me. So when you have the flu, antibiotics will not.
Susan, if you wanted me to jump in until Sydney's back with us, I'm happy to do that. I think to just pick up where Sydney left off, the influenza is a virus, so unfortunately antibiotics won't work in that scenario. There are some, the antivirals out there. Those can lessen the severity of the symptoms if they're used within the first few days, but sadly, not antibiotics.
Thank you, Natalie. So I just thank you so much, Sydney and Natalie, for joining me on this Facebook Live event today, and for all the work and effort you put into making this information available for our audience. And thanks to all of you who joined us here today. There will be Komen Facebook Live events like this in the future. You can also follow Komen on social media for additional resources. I hope the conversation today got everyone motivated to protect themselves and their loved ones this flu season. Thank you again to our guests and to our audience for joining us. Have a great day.
Thank you, Susan.